Good evening, everyone. It's 7 p.m. on May 26th. I'd like to call the Public Safety and General Government Committee meeting to order. We're going to start with roll call. Heidi Alterman, Nicole Ayers, Josh Goldstein,
Here.
Dominique Johnson,
Here.
Tom Keegan, and Diana Revolus.
Here.
I know that Nicole said she was probably not going to be able to join, and Tom Keegan has an award ceremony for his daughter, so he said he might be a little late. So we will just get going and hope that he can join us. I'd like to call for a motion to approve last meeting's minutes. Thank you, Councilmember Revolus. Does anybody have any changes or corrections to the minutes from last month? Seeing none, I will call for a vote. All those in favor of the minutes, please say aye. All of those opposed, please say nay. And any abstentions? Councilmember Goldstein abstains. Thank you very much. Is there anybody here for public participation who would like to join? I'm just going to look and make sure we don't have any participants. It looks like everybody, looks like there are none. So I will, going once, going twice, I'm going to close public participation. I want to welcome Councilmember Barbara Smith to our meeting this evening as well, and Board of Education member Karen Nelson-Bakey. Also, we are going to have a panel later on in new business when we have discussions, but first we have a couple of action items we need to take part in. So for the police department, we are going to read each of these. There's two for the police and one for the fire that we're going to vote on this evening. Number one is authorize the purchasing agent to issue a purchase order to AT&T Fleet Complete under NASPO pricing for equipment and services of Fleet Complete for an amount not to exceed $73,000 over 3 years, account as noted. And I will ask for a motion to move this forward. Thank you, Councilmember Revolus. We have Deputy Chief Zecca here to speak to this item. Do you want to give us a little bit of information on this?
Sure. As I think we've mentioned in a previous meeting, we historically were having some issues with our AVL system for our vehicles, and have done quite a bit of research with IT, and have decided on Fleet Complete as the proper way to move that forward. And DPW and the fire department have already moved to Fleet Complete for their AVL. So, you know, within the city, I think we're all kind of moving that way. So I think this will be a good addition.
Great, thank you. Does anybody have any questions about this one? Oh, y'all are being real quiet this evening. We've got till 7:30, so we're going to stretch this out. Does anybody have anything? I know I said as soon as I told the panelists not to come till 7:30, I knew this was going to be a short meeting. Okay, no further discussion on this. Yes, go ahead, Councilmember Johnson.
Well, I'm not doing this to stall, I promise. I just saying. So I just am trying to remember the AT&T Fleet. Is this something that we also have authorized? Like, is it every year, or is this a one-time expense over just when you need the upgrades? Oh, Chief Zecca, you're on mute.
You're
Sorry.
on mute.
Sorry, you think I should remember to unmute at this point. I apologize. This is a 3-year agreement with Fleet Complete. And obviously, since we have not used it before, we want to ensure that it is the proper system for us. It looks like it's going to be phenomenal and will really help, but this is a 3-year contract.
And so the other, oh, can I, Chair, may I ask a
Please, yes, go ahead.
Thank you. So then the other item obviously is about the software. Is that to run on the Fleet Complete for the, it's license for license plate reading?
Oh,
right?
I'm sorry, the Vigilant?
Yeah, Vigilant, sorry, my bad.
That's a completely separate item.
Separate, okay.
So
I just, okay,
you
got it.
want me to discuss that at this point?
Oh, no,
No, let's hold off on that because we have to move the item just because of our rules of order. So I want to make sure we're following that. So let's keep it to this first item and then we can certainly ask questions and have a conversation about the second item, but they're completely separate, just to clarify. Any other questions about the first item? All right, well, I'm going to go ahead and call for a vote then. All of those in favor, please raise your hand or say aye. Any opposed? Or any abstentions? That carries unanimously. So thank you very much. The second item on our agenda under the police department is number 2, authorize the mayor, Harry W. Rilling, to sign any and all agreements, documents, and instruments with Vigilant Solutions, LLC for the sole source purchase of Vigilant Investigative Data Platform annual subscription not to exceed $25,000 annually, account as noted. We also have Deputy Chief Zecca here to speak to this item.
So this is, currently we use LPRs, license plate readers that are Vigilant. We also have within that, you can search within that system. This is to kind of expand our capabilities. It would allow us to additionally search all the commercial data that is put into that system that we currently don't have access to. So it would, it's an investigative platform for as we're doing investigations to search that data. And this is, it's annually, it's the authorization for not to exceed $25,000. So we don't have to come back each year.
So this is annual, you'll have to come back and get permission every year or no? Okay.
No, this is to be able to renew this subscription annually.
Got it. Okay. Does
Because
anybody
once
have any
we're
questions?
using the data, we would like to be able, it becomes very cumbersome for a subscription if you're coming back every single year.
Sure.
I want to make sure we're not missing something.
What sort of commercial information would you be able to get from this?
It's from other license plate readers.
Okay,
So it's their databases.
great. Does anybody have any other questions or discussion about this? Yes, Councilmember Johnson.
Thanks, Chair. Just to follow up to your question. So that I know we've talked about this before, anytime we invest in data to make sure that would this be like data that then is securely stored on a server with the vendor?
It's the vendors, yeah, it's the vendors' data. It allows us to search their data.
Their data. Okay, great. Excellent. Thanks, Chief Zecca.
Any other questions about this one? Really?
I could go back to the other, but
Okay, we could be quick.
All right.
I can make a comment. I mean, I think it's really
Please
excellent.
make a comment. Yes.
These are 2 items to me that are showing how we're future forward in our technology in the police department, right? I mean, like it's great, right, to know that they're using. It seems like these are best practices technology that will really help you do the work you need to do. Is that seems to me, right, Chief Zecca? That yeah.
Yes.
Okay. Yeah, and that's
Ryan.
so.
I agree. I think any information or technology or help that we can give our police department is wonderful, especially to help the force we have right now, which I know recruitment is an issue. So any little thing we can do to help is great. See, now I am stretching things.
Okay.
Okay.
5 officers today.
Okay, does anybody else have any other questions? Going once, going twice. All right, all those in favor, please say hi or raise your hand. Any opposed? And any abstentions? All right, that carries unanimously. Thank you so much, Deputy Chief Zecca. We appreciate it.
Thank you for your support.
Anytime. Happy to. Yes.
In the vein of stretching it out,
Yeah.
just a quick thing I just want to note. In the past week, I did a ride along with the police department.
Yep.
And I just wanted to take a quick moment to compliment the absolute professionalism and aptitude dealing with very difficult situations, even in the couple hours I spent with the police department. And it wasn't just one officer, it was several between the dispatch unit, and patrol officers. And it just was a very impressive experience. Obviously, there's always issues to be worked out with the police, and that's why we're here. But I just wanted to say how genuinely impressed I was, and look forward to having the opportunity for future work and future ride-alongs.
Thank you.
So I was able to do my ride along yesterday because, as the whole city of Norwalk knows, I had COVID a couple of weeks ago, so I didn't get to set mine up till yesterday. But I just want to echo what Councilmember Goldstein said. I was super impressed. I rode along with Officer Prada, and I could not have been more impressed by her. And we had two very difficult calls that I couldn't hold it together about. So it was, not my line of work again. But they were just so wonderful. Everybody I came in contact with, I've also sat in the dispatch center, and I just think you all are amazing. And I can't say that enough. So thank you for everything you do. And I just think that the physicality of it is one thing, but the mental aspect of it is a completely different thing. And that was something I really saw yesterday. So thank you. Yes, Councilmember Revolus.
What I was going to say, I was going to hold off till after number 2, but just to give time, I am extending time. I want my ride along, first of all. Then second of all, I actually just wanted to finally say a thank you. Not all, but I finally driving by and seeing officers stepping out of their cars and actually interacting with the kids at the bus stop. And I literally had to pull my car aside, and I don't know the officer's name, but the last 2 that I saw were out there and they were engaging and they were talking. And I felt like it was finally truly heard. That's a great way of starting recruitment for our youth. And I just want to say thank you for that to be started. I want my ride along.
Have to send me your forms.
Okay. Hopefully it'll be email. I'll go through my emails again. I'm sure I have them.
I can resend them to you.
Yeah, I was
Thank
going to
you.
say, Diana, if you need them, I can resend them as well. No problem.
I appreciate it. Pregnancy brain. I'm sorry. I probably got it.
Totally.
And I do appreciate the praise for the department. We really have a tremendous amount of great officers, and they're out there. They're doing a hard job every day, and they really do a good job. Thank you.
Most definitely. Thank you for coming out.
Definitely. Anybody else before we move on to the fire department? Great. We're doing wonderfully with stretching this out, guys. So I really appreciate it. Okay, the fire department has one action item this evening. Number 1 is authorize the Mayor, Harry W. Rilling, to sign an information sharing and access agreement with the Department of Homeland Security, DHS/Federal Emergency Management Agency, FEMA, to access national flood insurance claims data for Norwalk. Do I have a motion to move this forward? Thank you, Councilmember Revolus. And we have Michelle DeLuca here to speak to this item.
Hi, good evening. So this really is just to collect the data from the actual claims that have been submitted by Norwalk residents over the past few years. Typically, we can get some aggregate data from the National Flood Insurance Program's website, just about how many residents have flood insurance. But to actually see the claims that have been made, we have to request it. Again, years ago, we could just request it from the state of Connecticut. They'd share the data with us. Now, because of privacy, and it does contain, again, specific addresses, the Department of Homeland Security and FEMA, I just want a memorandum of agreement signed with the municipality, just saying how we're going to use it, how that we're not going to share it. We can request data up to a couple times over the 3-year period. But again, it's just kind of a standard agreement to get the data. And part of the benefit for us is being able to see what claims have been made and in what areas might actually open up some doors for other mitigation programs. So the traditional hazard mitigation grant program and most FEMA programs are a 75-25% split. So 75% federal government, 25% local. For some properties or areas where there have been multiple claims made, there's a severe repetitive loss and a repetitive loss mitigation program that either has a 90-10 cost share or 100% cost share, with the federal government picking up the complete cost of the project. So without really having that data of, you know, where the addresses are, what claims have been made, it's been difficult to pursue any of those programs. And we also want to make sure when residents do have flood damage, that we're always encouraging them to submit claims, flood claims with the NFIP. This way, again, it could open up some additional funding for them. But again, this data will let us help them a little bit better and provide better guidance after we get the next, or when we get the next big storm. And that's it. Nice and
Yes.
easy.
When, not if, unfortunately. Does anybody have any other questions or comments? Councilmember Goldstein.
Quick question. How long, I guess, I'm looking, of course, usually when we talk about these MOUs, there's a time element to this. Wondering how long the MOU is supposed to last, or is this something that's supposed to just get revisited at a point to be determined?
I want to say it's a 2-year period. There's a chance it could be 3 years, but I'm like 90% it's 2 years. So we can make more than one request over a 2-year period. The hard part with, again, the federal government is they are a bit behind on paperwork. So we know it could take a few months for them to actually execute the agreement as well. So it would be effective for when everything is executed for that length of time.
So we sign our part, and at some point to be determined, a representative from FEMA and or DHS signs it, and at that point, that's the effective date, not when we sign it.
Correct.
Okay.
Yep.
If for some reason we sign it, I mean, summer, you're talking about flooding. I mean, summer is one of the biggest times for flooding we have here. What if something happens in June, July, August? How are we, can they backdate it and give us access even if it hasn't been fully executed yet?
That's a good question. I can double check, but again, I know it's the FEMA tends to work in its own timeline. So it would almost depend on who specifically we're working with to figure out, can they make an exception, give us some additional data. Again, they're saying a few months, and I don't know if that's just kind of giving up or trying to be realistic with the expectations. Again, maybe we'll be pleasantly surprised, but
right.
Again, the data is always going to be useful.
Yeah, I agree.
Are there any other questions or comments? Yes, Councilmember Johnson.
I'm just thinking about this because we were in a sustainability workshop all day. And so, yeah, and so thank you, Michelle. And I think that this just makes me think of how I imagine this data is really going to help you in your proactive work to help protect everybody here in the city, to try to figure out stress points. I can imagine. Is that part of maybe a benefit indirectly even?
Yep, it is one. And we also know that residents move into the area, and some of the data or historic data for the home may not always, I guess, transit or be passed on when a new owner buys it. So what we saw after Isaias with a lot of the flooding, some of the homeowners that were affected actually had just relatively recently bought their homes. So when we asked, is there any NFIP claims on the home? We don't know. Like, well, did you get any data? Do you know anything of the history? So it's a lot of time had to be spent trying to navigate them to, again, figure out, how they can get that historical data. Whereas again, if we have some of this, it does help. We can always push the homeowners and so they can, again, if they have to find more receipts or anything else, but it does give us a better idea of, for example, if 123 Main Street has had 3 flood claims in the past and then they get hit again, it might again open up some additional funding or different funding streams. Whereas again, if it's a new owner, they may not know where to go for that data. So it's just kind of a help to say, this isn't the first time this has happened, and give them a little bit of the history. So when they're that stressed, they don't have to try to find the data themselves.
That seems like such a strong benefit here too, I would imagine. Thank you, Director DeLuca. Appreciate it.
Welcome.
I think it sounds like it's not only a benefit to us in emergency services and the city as a whole, but it's very relevant and important for the citizens of the city too. So I think it's great. Does anybody else have any other questions or comments about this item? Before we bring it to a vote, I just want to note that Councilmember Alterman joined at 7:14. Just didn't want to interrupt the conversation. All right, all of those in favor, please say aye or raise your hand. Any opposed? Any abstentions? That carries unanimously as well. Thank you very much. So thank you, Michelle. Appreciate it. Sounds like a great program, great asset for us. All right, so we have a few minutes. Actually, I'm looking at, I just want to make sure everybody's here. We actually, I think, have everybody here. So thanks for being early. We are not normally this quiet on the Public Safety and General Government Committee. We usually have a lot of questions and comments. So we went faster than I thought, but that's great because then we can get everybody out of here and hopefully, in bed on time. So I just want to thank everybody for coming tonight. It's Mental Health Awareness Month, as I think all of us realize and many of our constituents realize. But as we all know, mental health is something that we deal with all the time, not just during one month of the year. And so we thought it would be very important, Councilmember Johnson and I being the chair of the Community Services Committee, and I being the chair of the Public Safety and General Government Committee, started a conversation in late April about doing something to really educate the public about what resources are available both on the city side and the school district side, because mental health affects so many people. So we have gathered together what I think is a dynamic team here in our city and our school district. And I'm really looking forward to hearing what you all have to say and the news you have to share about what resources are available. So glad that this is recorded and we can share it after the meeting for anybody who can't be in attendance this evening. And I just want to turn it over to Chair, Council Member and Chair Johnson, if you'd like to say a few words before we get started and introduce the panel.
Absolutely. Thanks, Chair McMurr. Yes, this was came out of conversations, right, from community members that were reaching out. I think that's really the focus for us is thinking about, well, how can we connect them with resources? And I want to also give a big shout out to our counterparts on the Board of Education. I see Board of Education member Karen Nelson-Bakey is here, and she's been integral in bringing the Norwalk Public Schools piece over here to a council meeting. And I think that that's phenomenal that we're having these cross collaborative conversations. And we have some incredible people from our city government here, our city staff and the community. And so I'm going to pass the mic directly on to the Chief of Community Services, Chief Daniels, to introduce all these wonderful people to talk about their fantastic work.
Awesome. Thank you. Thank you, Jen McMurr, who's the chair of this committee and also chair of community service. Thank you so much. So good evening, everyone. I do have a couple of remarks I'd like to say to get us going. I'm honored to lead tonight's discussion about mental health and behavioral health services, resources, and supports provided by our school mental health professionals and our community partners across a system of supports. Our goal is to raise awareness about those services within the district, the city, and community, and provide information how to access these important resources. We know that effective collaboration between school mental health professionals and the community mental health partners only broadens the availability of supports and enhances the overall access to mental health care in our community. And I'm so excited to say that this is happening and it is only going to get better. The Community Services Department is here to help facilitate and help promote mental health awareness, but also reduce the stigma. I'll be remiss not to share that we know our country is grieving right now from 2 tragic mass shootings, one that happened 2 weeks ago in Buffalo, New York. And as we prepared this, we all experienced a tragedy Tuesday in Uvalde, Texas. Our prayers go out to the victims, families, friends, the communities, the first responders, and all those that played a role to at least have the other children, their families, and teachers and staff get home safely. As Chair McMurray indicated, this discussion was planned some time ago, but I would like to state that the assumption that the acts of mass violence are primarily driven by mental illness, that is not true. There are many, many, many complex factors. I think we're all trying to struggle out how and why. So blaming mental illness is something we shouldn't do. Blaming mental illness alone for mass shooting inflicts a damaging stigma on the millions of people who suffer from mental illness, because we know the vast majority of whom are struggling, they are not violent. And so I want for our listeners to know that if anyone is impacted or struggling, we want you to know, your city wants you to know, your community wants you to know that you are not alone and there is help. So I want to thank the panel in advance for taking time out on a Thursday night. We have an amazing group of experts. So I'm joined by an amazing team. I will be moderating tonight's discussion. We have city leaders from the district. We have leaders from the district, from our city and our community who will share, and I will serve as the moderator. So we'll do a quick introduction. We'll move this along. I'll just introduce your name, but if you can share with the public who you are. So we'll start with you, Mr. James Martinez. Who are you?
Good evening, everyone. My name is Jim Martinez. I am currently simply put, title is the Director of School Counseling and Social Services for Norwalk Public Schools, pre-K to 12.
Awesome, thanks. Ana Vivian Estrella. Good evening.
Good evening, everybody. I'm Ana Vivian Estrella, and I am the Director of Human Services for the City of Norwalk.
Awesome. Teresa Argandesi.
Good evening, Teresa Argandesi, Assistant Director of Health for Community Health at the Health Department in Norwalk.
Danique Lewis.
Hello, everyone. Danique Vedema Lewis, Director of Equity and Collaborative Action at Norwalk Acts.
Awesome. Margaret Watt.
Good evening, everybody. I'm Margaret Watt, Prevention Director at Positive Directions, the Center for Prevention and Counseling, and co-chair of the Norwalk Partnership, which is the local prevention coalition.
Good evening. And last, but certainly not least, Ms. Diamond Seed.
Good evening, everyone. My name is Diamond C. I work with the Human Services Council. I hold 2 positions. I co-chair the Norwalk Partnership with Margaret Watt, and I also coordinate, direct the school-based health centers here in the Norwalk Public School systems.
Thank you, everyone. So just to give in a run of how we have prepared tonight's discussion, we would like to share with the public and with you, our council leaders, talk about what is happening in our schools, the amazing work. Then we're going to take a journey of how that's connected to some of the new city services. We're so excited to have Ana Vivian, our new Human Services Director. And then we're going to take a left turn and connect it to what's happening in the community, because we cannot do it alone. We need everybody on board. And then he's going to talk about what are some of those initiatives and coordinated efforts as a city, which includes both the district and the community. And we're so excited that Diamond Seed is going to actually share an example of what's happening in the district. And then we're going to turn it over to Margaret Watt, who is just an amazing leader and advocate for mental health and behavioral services and share about what's happening from our adult perspective, and then make sure at the end that our community know where to access those resources, where to find them. So Jim, I'm going to turn over to you. Good evening. It's all yours.
Good evening, everyone. I hope you can hear me well with my Wi-Fi. I think Jen, you might have made a comment about getting us to bed early or something like that, because I'm way past my bedtime. I'm not sure who said that, but
It was
I'm kidding.
definitely me. I'm sorry. I'm hoping to keep this before 9.
No, I'm kidding. I'm kidding. The
But it's important.
older I
so.
get, the less the less energy I have. But I certainly am very motivated to be here tonight and to share some information with all of you and to be part of this conversation. First of all, let me just give you just a little quick context and background. I have been an employee of the Norwalk Public Schools for almost 20 years now. I started my career in Norwalk as an assistant principal at Roten Middle School, and then I would be the principal of Foxfront Elementary School for 12 years. And 2 years ago, the then Board of Ed approved a proposal for a counseling program, a school counseling program redesign. And back in my old life, in my career, I was a high school teacher, and I started in high school, then middle, then elementary. But I was a school counselor, and I was also a director of social services and school counseling in New York. So full circle, they created, through this redesign, they created this position, and the rest is history. I applied, and so I was able to successfully land the position, which was new to the district just last year. And if I knew then what I know now, I would have probably advocated to have the position in the district a lot sooner, given all the unbelievably great partnerships that I've been able to develop, with many of you on this call right now, and providers. It's been, very, and not only cathartic, but it's also been very inspirational to be able to be part of a team that helps the families and children of Norwalk, the city of Norwalk. Back in June 2021, and I'm going to probably invite Margaret to in a moment to speak further to this, because she's more well versed in it. But we conducted a survey in June of 2021, conducted by the Search Institute, and we had about 2,500 students, a little over 2,500 students take the survey. 44 participated with grades 7 to 12, and the data that the youth survey yielded was pretty compelling. And let me just say before I just, because I think Margaret, for this first part, and Tina and I are going to tag team this, and then I'm going to talk a little bit about what we're doing in the district for social emotional learning. Let me just say that at the risk of becoming desensitized to hearing the word mental health and mental health awareness, we could not say it, give it more attention, and preach it enough today. We have so many needs around the city of Norwalk. Well, forget about, I'm talking obviously the nation, but for the purposes of our conversation, obviously we embrace the needs of our families here in Norwalk, and this youth survey gives us a snapshot or picture of what's been happening in the last couple of years. So I'm gonna ask Margaret, invite her to come and talk a little bit about that. She has a few slides that she wants to share with us. Nothing too deep and nothing too extensive, but I think some data that you might be very interested in seeing.
Thanks, Jim. Can everyone see my slide?
Yes.
Okay, great. So as Jim said, we conducted this survey last year that was funded through the Drug Free Communities grant that I manage here at Positive Directions, which is a federal grant that we run for this, that we got for the city, and that actually requires us to do a youth survey every couple of years at a minimum around substance use, because it feeds our prevention work on that area. And what we do is we add in mental health and other information that we partnered with the city and the school district to look at, what instrument are we going to use? We use Search Institute's instrument. what data do we want and need? And I just wanted to highlight that now because next year will again be a survey year. And it's an opportunity for us to remeasure and see where things are getting better, where are things of continuing concern, and also what new or other data items might we want for this coming year. So what's important to know is when we surveyed last year, we were originally going to survey in the fall. It ended up happening at the very end of the school year. So the context is almost a full year of remote learning, right? Kids had been isolated most of the year at home. And so the first thing, unsurprisingly, is that 73% of our middle and high schoolers said the pandemic had been very or somewhat stressful for them. And they all, I mean, a large proportion reported an impact on their relationships, lack of connection to other kids, weaker relationships with the kids that were their friends. Most of them, half of them had weaker relationships with teachers, and a significant proportion disagreed that their teachers had provided a safe space to share how they were doing during the pandemic. This was information we provided to the Board of Ed last year, have been working on with Jim to look at how do we move the needle in the other direction, right? In terms of mental health specifically, we had 39% of all students from 7th through 12th reporting depression, basically a third of middle schoolers and almost half of all high schoolers. So these numbers, by comparison to pre-COVID, these are much higher. And we also were able to ask about suicide, which I commend the district for being willing to ask, because we also I surveyed in 2 other communities last year, and many won't ask that question, but it's so important to look at. We did have 13% of our kids who reported that they had seriously contemplated suicide during the preceding 12 months, and 6% reported that they had attempted suicide in that year. So thank God we didn't have any deaths, but I'm sure you all know there have been teen deaths even very, very recently in the area around us. Now, who was the highest risk population? We were able to break down our data. We gathered it in such a way that we can look at it by gender, sexuality, race, school, zip code, grade, all kinds of factors. Some of you may know that it was a little controversial among some middle school parents that we asked kids about their sexual and gender identity, but it's so important to recognize that we need this information because it highlights that that was the group at highest risk with extremely high levels of depression and 1 in 5 reporting a past year suicide attempt. So this is very concerning. And again, this is something at the city and in the community rather, and in the schools that we've been working on. The other groups that had higher rates of depression than that average across the middle and high school levels were girls, basically 49%. So basically 1 in 2 girls was experiencing depression. This is 49%, then like 46% of students experiencing financial strain, multiracial students in special ed had high rates of depression, and then students who are Black or Hispanic or English language learners, all equally 43% experiencing depression. And just again, here I would say that in the work we've been doing through the Norwalk Partnership and in collaboration with Norwalk Acts, we've been really intentionally putting together logic models and plans to support the highest risk groups. Happy to say that Positive Directions and Youth Business Institute we jointly applied for and got an ARPA grant to literally address some of these target populations.
And one of the things you're going to hear me say probably multiple times to anyone that'll listen is that the work that we're doing as a community, as a city, as a school district, and I will say again, in the role that I'm playing right now, I can't do it alone. I cannot bring this and bridge this need to, on my own. So that said, the slide that you're looking at right now is just an example of what Norwalk Public Schools has committed to in terms of social emotional learning resources for grades K-12. And there's a list of them. I won't describe them each at a time, but I do want to highlight a couple of them. Some of these are resources that teachers, it's like almost like a plug and play where they have some great lessons and that school counselors and school social workers can deliver, and even classroom teachers. during SEL time, whether it be elementary, middle, or high. And, they run the gamut of all topics such as, kindness and bullying and, in terms of, listening skills and being able to listen to what the other person is saying, facial expressions, all kinds of different types of social skills that are important for children to thrive and to become decent citizens and productive citizens when they grow. We just digressing quickly back to what Margaret was talking about in terms of the LGBTQ data that we were able to yield from that survey. We engaged the Triangle Community Center, where we provided all school psychologists, all social workers and school counselors in what they call LGBTQ 101 training. And in short, it really is just a professional development that helps those support staff or mental health support staff understand the journey that an LGBTQ young person goes through and some of the barriers and challenges and how to address them and how to support them. And they turnkey it, and the next step is to turnkey it to the classroom teachers, because we have students in our school district that identify as LGBTQ, and there are a number of them that are struggling because of the lack of understanding of where they're at. And so that's where that's at. We also, even as we speak, we have the Wingman Youth Leadership Program on that list there. You may or may not be familiar with the name Ian Hockley. He is a father of a 6-year-old who was murdered in Sandy Hook. He founded the foundation of Dylan's Wings. His little guy was Dylan, and it's a peer-to-peer support program to empower youth. And so we have had, and by the end of this week, we would have about 300 high school students in all 4 of our high schools trained who would have undergone a full day of training, a workshop on the Wingman Youth Leadership Program. In fact, tomorrow will be his last day. He'll be with us tomorrow. So I just want to give you an idea. These are all kinds of resources that we have and that the district has committed to invest in and train our staff in, and it's ongoing. It's ongoing, especially for as the years, as we have new staff come on board, and as the grade levels as students continue to grow, get promoted to new grades and different developmental levels. Next slide, please. So, this one of the biggest aha moments I would say that I had when I entered into this role is how much real, meaningful work and the great impact that can be made when collaboration takes place. And talk about the term coordination of care. We may not, and we're working on a formal process as we speak, but we've developed an opportunity where I am able to partner with a host of, and these are just some examples of the providers that I meet with in standing meetings every month, and that directly support. And again, what we always used to say, and when I started this role, I used to say to some of the providers that I started developing these relationships with is, our kids are your kids. They're our families. They're your families. So they're all part of the same community in Norwalk. And there was a time that we were providing these supports, but kind of in isolation, and not connected with the follow through of what we support students with at school, and then what they can provide, what the community can provide. So we have, a number of resources and providers that help us, through Mid-Fairfield, Child Guidance. We have clinicians that are housed at the high schools. We have intensive outpatient program students, extended day program students, bounce back for trauma-informed care. the school-based health centers that are housed out of our schools, family, FCA, Family Children's Agency, Kids in Crisis, instrumental to this last couple of weeks with the tragedy that we had in our own backyard here with that poor family with the fire in summer who succumbed to that fire. We've had the Den for Grieving Kids support us in addition to the other providers as well. But we've been working in tandem in providing support to the family and to the sibling of the victim. And again, Triangle Community's on there again because they also are on hand to help our youth. And the Norwalk Community Health Center, who also have provided about 24 slots a week for mental health and wellness checks for not only youth, not only our students, but our teachers, our staff, and families. So I could not be I cannot be more, just to say the word honored. I would say grateful that that I can be in a position where I can help contribute and work with some of the most amazing providers that I think I've ever met. And there's so much to what is being provided here in Norwalk that many people don't know. And I'm grateful this is an opportunity for us to be able to have this conversation so that it's out there that these things are not working in isolation, that we are making some really strong ties and connections with the providers and the Norwalk Public Schools. And I don't plan on going anywhere. So as long as I'm around and they're stuck with me, and these relationships are going to continue to grow, and we're going to continue to help more and more kids.
Awesome. Thanks, Jim. So we're going to ask Diamond Seed, who is a community provider, to speak to what those partnerships look like in the school. As you all know, Diamond leads the school-based health centers, and there's so much research that supports and endorses why those services are so needed in the school. So Diamond, good evening.
Good evening. So I was fortunate enough, as in our partnership with Margaret, Jim, we were able to bring some of the school providers into a meeting early middle school year, just to make the referral process a little bit smoother for all of the services, because at the beginning of the school year was a lot of overlap in services we found out. So using those partnerships that Jim just explained and showed you guys on that slide, a lot of those partners were at the table. And because of that meeting, we were able to increase our communication with each other. So a lot of our mental health providers are connecting more to make sure these services aren't overlapping. Thankfully, that has made the process a lot smoother. We're able to see more kids and make sure that the referral process, if the school-based health center, if they need more intensive mental health services or maybe person-to-person, things like that, we're able to refer them better to those other community providers. So formally how it happens is they see Kids in Crisis if they're at a crisis at the beginning. Kids in Crisis will refer them to Mid-Fairfield, the school-based health centers, or child guidance. Through that, they'll come to one of us and they're seen. So because of that, like I said, one of the partnerships is just greater referral. Like Jim said, there is becoming a more formal process because it's not all perfect, but we have ironed out a lot of those kinks, thankfully. So especially with the year after COVID, a lot of kids just need more of our support. Sometimes it is just that talking in the office, having that one-on-one person that you can go into the office and, speak about your day if you're having a bad day, or maybe you don't know how to simply go back into socializing in the classroom or with your peers during lunch. So, sometimes it can be very as a crisis, or it could be something as simple in a way of saying re-socializing and getting back into the classroom. So ironing out those kinks and really seeing what priority, who needs more, who needs outpatient, really became a better referral process. And it's actually great because this summer we are able to extend our services. So we'll continue seeing kids throughout the summer at the school-based health center. And even that process, we're able to refer them to families and children or child guidance if the family needs holistic services. And if it's just one-on-one with the child, then they'll stay seeing the provider through the summer. So it it has been a great process. We're still working out things like Jim says, and hopefully next year it'll be even a better referral process and really getting more community partners to the table. So that's just my example, and it's been great. So thank you.
Thank you, Diamond. And I'm also glad to say that the school-based health centers council members is a recipient of the city's allocation of the American Rescue Plan Act to allow them to increase capacity. So just want to connect the dots for you. This is exactly how we wanted to use that particular funding, because as you would continue to hear, the need has definitely intensified. But we want to make sure that capacity is also increasing so that we can meet the demand, because people need help. And
Right.
so we want to minimize, to the extent that we can, the waiting list. And so we're just really excited to have the school-based health center be a recipient so they can increase and serve more of our residents for those who need it the most. Thank you very much, Diamond.
Yeah, thank you, Lamont. That's actually why we're able to see the kids throughout the summer. And a lot of those kids, like you said, it's funny that you said that, because a lot of the kids that we are seeing through the summer are the ones on the waiting list. So they will get the services so they don't have to wait till next year and continue to be on that waiting list. So that is, I didn't even think of bringing up the ARPA funding, but yes, because of the
That's
ARPA
my
funding,
job.
right? Because of the ARPA funding, we are able to see kids through the summer this year, and even next year extending it, fingers crossed, hopefully to after hours, so that some of those kids who can't see 9 to 2 or 8 to 1, whatever, some of the clinics are open at different times, but then they can go on to like maybe a 3 to 7, or maybe the more of the family counseling. So yes, thank you guys for that, choosing us to be one of the recipients, because that is what we're able to do, and you will see that in the numbers.
Awesome, thank you. Councilmember McMurray, I just wanted to make sure it's okay. We have 2 more presentations because I wanted to keep the school child Q&A and then the adults Q&A, if that's okay with you.
Absolutely. This is wonderful. Yes.
Thank you very much. So as Jim pointed out, we're excited from the city side that we're going to transition to talk about how the school is playing a pivotal role for us with the city in our partnership as they provide and or connect children, youth, and families to services outside of school. And so Anna Vivian, our Human Services Director, is going to talk about the city and school partnership and share some examples of what's happening and what is to come.
Absolutely.
Good evening, Anna Vivian.
Hello, everybody. So I have the fortune of coming in at a very important and very exciting time, because the Family Navigator partnership with the school system was originated during the peak of COVID to create connectivity and to make sure, because there's an acknowledgement that if the families didn't have internet in their home, didn't have a way to connect to remote learning, they probably had other needs. Lamond smartly was aware of that acute need, and it was displayed. The Family Navigators were very, very busy connecting families to not just the internet, but making sure that they could follow through with the entire process, and that the children could be successful through the remote learning process. With that being said, in that partnership, it was great, but as COVID progressed and everything stabilized, we wanted to make sure that that continued partnership with the Family Navigators and the school system remained in place, because of the great effort and the great impact that had been created, and the acknowledgement that new people come in, new crisis, new issues arise, and we wanted to continue to be a support to the school counselors, the school support staff, and the community-based services that are now in place and more formalized. So Jim and I met earlier this week actually to do a relaunch and make sure that that connection between all of the school support staff and the community-based services at the city of Norwalk formalize a little bit more and make sure that those connections are being made. Because there is a lot of resources, we wanted to make sure that we created a very structured pipeline so that our services wouldn't get lost. But really what it boils down to is that everyone's trying to be a jack of all trades. Everyone's heart is in the right place and trying to connect the students to all of the resources. And where we're leveraging our family navigators and our youth care coordinators is that specialty that their job is to make sure that they are connected to the Norwalk resources, all of the Norwalk resources. So this is branching outside of the mental health sphere. There's a lot of mental health services, and we will continue if there's a need and they're on a wait list with the school-based services, we will connect them to alternative mental health services. But this also has to do with the other pieces that can interrupt this child's learning. So the basic needs. If the family is going through a housing crisis, if the family is experiencing a new crisis. So to give you an example, we had a family that the spouse died due to COVID complications, and they were working part-time. And so now they couldn't meet their financial needs. This was a family that had never touched social services before this incident. And so our family navigators were able to then connect them to rental rearage support, so rental assistance, workforce development to increase their wage, support systems for the child and the grief and the family in grief, and additional services, including benefits, government benefits that they had never applied for. So really that holistic viewpoint of the family as an entire unit. And so that just gives you a glimpse of how easily someone's life can get extremely complicated from one day to the next. They never had to ask for help, and then all of a sudden they needed help from 5 different agencies. And that process in and of itself can get difficult. It's a lot of intake process, it's a lot of paperwork, it's a lot of phone calls. And so the purpose of our family navigators is to make that assessment, connect them to the right resources, and make sure they make it through the door. And it's family driven, so it's client centered. They can accept and reject referrals the way they want to. It's completely spearheaded by the family themselves. We just make sure we make ourselves accessible to provide them whatever they need in their moment of need, and we leave the door open. If they need to call us back again, they can call us back again. If they come in with a new need, or they have a friend who now has a need, we leave that door open. And that, I think that's the special piece of the family navigator, that it's not this, it's not attached to a certain particular group or mission. It's really holistic, and with the trigger, with the target, the target to make sure we always have the most up-to-date information on the resources in the city of Norwalk, because we are resource rich, and that's wonderful, but we have to make sure that the people that need those resources can make those connections. So I spoke really, really fast, but with Jim, what we're going to do, we're going to make sure that the school counselors are aware, they're knowledgeable, they know how to make that referral, that connection is continued. And so we'll have a presentation to relaunch family navigation for those new staff members that weren't involved in the original pilot. And we're also going to have monthly check-ins with the staff so that we can have that ongoing conversation. They can ask us questions, we can answer, and we can just have that nice flow of resources going back and forth. And ultimately, what the outcome is going to be, or the intended outcome, and the one that we've seen so far, is that it's a reduction in duplication of services. We're leveraging, and so we're not straining, and we're not overburdening the people that are already involved. And we have coherence in service and delivery.
So Anna Vivian, actually, she schooled me today on a couple of things, right? And on that note, just quickly, so this is bringing the home school partnership to a whole nother level, right? And it's a genuine level, because now what we're doing is, and what I mean by she schooled me is that she asked me about what my social workers do, because I supervise the social workers as well as the school counselors. And I mean, our social workers, you name it, they do it. I mean, obviously their primary role is on the educational front, and to support students, especially students who are receiving specialized learning in terms of counseling and such. But, they do make the phone calls, they do make the home visits, they do help as needed families who maybe need to tap into resources. And Anna Vivian's like, wait a second. Why would they be doing all of that when we can do it? They can focus on the educational piece. We can focus on, the wellness part of this. And so that was an eye opener as well. And moving forward, this is exactly the coordination that we're going to be perfecting, if you will, because they only have one. I always say they only have one shot at this, our kids, and we have to make it right. So, thank you.
No, that's amazing. And please, panelists, we talked about making a conversation. So if something triggers you, please jump in. Anything else, Anna Vivian?
I think that sums it up. But to Jim's point, I think we get wrapped up in wanting to provide everything that we can provide in the moment when we have that person struggling in front of us in the office. And one of the things that we had a candid conversation about was just making sure that everyone can still have the bandwidth to focus on their area of expertise. The school social workers, the counselors, they have an educational focus. And if they're getting strained and pulled in other directions, that means they're losing sight of that, and not intentionally. It's because they're getting spread thin. And so that's why this partnership and making sure that it's firm and continuous is so, so important. So thank you, Jim, for bringing that up. And, I definitely look forward to just revamping everything and making sure that that continues to be strong. And I see some hands up, so.
Yes, yes. Whose hand went up first? I didn't see.
I, as chair, will defer to Councilmember Goldstein.
Thank you, Chair.
Well, thank you, even though you totally didn't have to do that. I had a question about the survey, and I don't want to minimize, it's obviously very important. When the question was asked about how students, the percentage and how much, to the extent to which they feel depressed, can you talk to me a little bit about, please take this as this is a simple question, but I promise. What does depressed mean? Does depressed mean chronically sad? Does depressed mean I had a bad day and therefore I'm depressed? Obviously there's a lot going on, but I just wanted to get a sense if you were able to glean from the survey and from conversations you've had with students, what you think depressed actually means.
That's a great question. Margaret, you want to take that one for us?
Yeah, Josh, what I can do as the conversation goes on, actually look up the exact data item and as how it's asked, because I don't want to misstate it. But the basically in these surveys, and we also did an adult survey last year, and usually depression is feeling sad or hopeless for the majority of days in the 2 weeks prior. And so that would qualify, sad or hopeless for more than half the days is literally used. It's the basic survey language that's used generally to identify depression.
Okay, that's very helpful, because I didn't know if the question that appeared on the form was, do you feel depressed?
Right, yeah, no, because that would not be a good,
right. How would you know?
Question. Right. And
okay.
Are you more depressed than someone else? No, yeah.
Right. That's
right.
Very
so
helpful.
It's a validated, the questions in the survey are validated by a lot of research. The Search Institute survey instrument that we used, they are a nationally known nonprofit that specializes in youth research. They have 30 years of history. So these are really, really robust survey questions and data that is comparable to other communities, other states, et cetera.
And just a quick follow-up. Had there ever been a survey done like this in Norwalk before this one from the middle of 2021?
Only once, and that was in the fall of 2018 when Danique, who's now here with Norwalk X, when she was at Positive Direction, she conducted the first survey. And that was also using a search instrument, search, what is their name? Search Institute survey, but a different tool, but the depression, the suicide, the substance, the core measures, we use the exact same language. So we have repeat points in time.
And forgive me if I missed it during the presentation, or if it just bears repeating, because it's probably very important. And Danique, help me out if, the difference between 2018 and 2021. What are we talking about? You know, how much has the paradigm shifted really since COVID happened?
Margaret, do you want me to take that one or?
Go ahead. I'm going to pull up where people can even see the survey data.
Okay. All right. So when we had initially surveyed Norwalk in 2018, we used the Search Institute Developmental Asset survey. So that is really talking about the building blocks, both that young people receive from externally, from their community, from their families, from their peers, teachers, as well as like the internal kind of assets, or like their moral compasses, their core competencies, in addition to substance and other questions. When we were embarking on the second cycle of the survey, we really wanted to ensure that there was a strong partnership between the data that we were collecting, not only for Margaret's purposes through the Drug Free Communities Grant, but as well as kind of the Norwalk Act Social Emotional Initiative, as well as the work that was happening within the schools. So we changed the survey tool from the developmental assets survey to the developmental relationships. And that really stresses, it's newer research coming out of Search that not only talks to the importance of young people having all of the building blocks, but also the intentional developmental relationships that they need to develop to be able to thrive as adults. So we really looked at really the work that was happening within the school district. That survey was closely aligned with the Castle competencies, and it really fulfilled what we were envisioning for the work to look like in Norwalk. So I think that for a lot of the survey information is similar, but I think that we were walking into this last go round of really being able to say, after experiencing a pandemic or being in the thick of it in 2021, we knew how critical those relationships needed to be coming out of the pandemic, as well as being able to have the additional support from Search to not only ask questions that were very COVID specific, but also aligned with the work that was happening within the district around race equity and social justice. So really, it provided us an opportunity to really be able to get this point in time snapshot to really help to inform not only the work that was happening within the school district, but also the work that was happening within community.
And Josh, just to add one more thing to compare the data points, I just went back to confirm. And in the 2018 survey, 20% of the students surveyed reported signs of depression. And so this year it was, practically double that.
Yeah.
We didn't survey all the same grades, because last time in 2018, it was every other year. And this year it was all sixth grade, or all, 7th through 12th. But so basically the depression rates doubled.
That's crazy. I mean, that's phenomenally important to emphasize. The fact that it's doubled in 3 years, that's wild.
Mhm.
And it's
Wow.
mirrored in the state and national data too.
Yeah. Thank you, Jen.
Thank you.
Thank you. I just wanted to commend the school district and the city workers for just working together in partnership, because that just makes my heart happy. It's something that I joined council to try to make better and do more of. And so that just makes me really grateful and appreciative to all the work you're doing. I did have a couple of questions. I was wondering how many family navigators we currently have, and based on the caseloads that are coming in, especially if there's an increase since the last time we surveyed and since we started this program, do you feel it's sufficient enough?
So
Go ahead, Anna, you want to take that?
we currently have 3 family navigators, and something I didn't go into the presentation is that we have 2 community resource specialists, and we also have 1.5 youth care coordinators, and they all have slightly different expertise. And so, but they all pinch hit for each other, and they all are collaborative and share resources. So the 3 navigators there is data, and Lamont can speak to the data a little bit more. We are shifting the way that we collect the data because the original data points had to do with that internet connectivity and making sure that they knew how to use the technology and making sure that they knew how to connect the students to remote learning. So it had a slightly different focal point. So we are looking at changing some of those data points and really flushing it back out. So I can't necessarily provide a comparison. In the original pilot with the internet connectivity, it was that we were looking at about 1,000 families. I think it ended up being in the 900s, and then around 600 that were actually served in students, and around 418 family units, because you can have multiple students in a family unit. So yeah, it was around 400 and some.
You're doing good, Anna.
See that little noggin. I did have pregnancy brain for a long time, but it's starting to come back, and so the numbers are starting to peek through again like they used to. But yeah, so it was around 418 if I'm remembering correctly. Those are huge numbers. That's a lot of families. That's a lot of individuals, and we do plan on hopefully being able to service more. And the original job description, I'll say, is the navigators are expected to be able to carry 200 people each. And that speaks to the fact that they're that connection between the two. They are not meant to take over a case from a community provider. They're not meant to duplicate any services that are already in place. They are really meant to be that bridge, that connection to get them to the services, to make sure that they make it through that door. So I know 200 sounds like a very, very big number, and we'll be negotiating it, right? As we collect better data, as we make sure that we are making sure that our navigators are doing some self-care too, because that is a very high caseload. We will probably, and Lamont, I'm sure, will be supportive if I have the data. If we need more resources, we won't be shy to come back to council and ask for that. But right now we do have the 3 navigators that are full-time. The only plug I will put in, shameless plug I'll say, is that they are grant funded right now, or they're partially grant funded. And so, you know, depending on the funding, we do risk losing them if they don't get absorbed in the budget. But that's a conversation for next year. My understanding is I will work very diligently with them this year and make sure everything's in place. And I know we will work hard to keep the resources we have in place and monitor to see if we need additional resources.
Thank you very much.
I just want to make the connection and just acknowledge former Chair Smith, because we went before there was community service and personnel and presented this concept. And so again, I always like to make those connections because it's important to me, while this is grant funded, you know, that we do have, you know, some operational support budget to do this, but it's important that, you know, both you as council members and our taxpayers know that this is how your taxes are being used. So just want to thank the Common Council 2 years ago to approving it and granting this. And we look forward to continuing now under Anna Vivian's leadership to then report out and really be able to provide the data and the analysis of what's happening and how we are making impact in our residents here in the city of Norwalk. So thank you, Anna Vivian. Thank you, Chair.
Can I just add something to that real quick? Thank you for that acknowledgement, Lamont. That it's the Dalio Foundation that has provided the grants, and you know, I think they're pretty solid. So I hope that they will continue to be involved and to re-up that grant as it comes up. And but I also have a question. Altice was involved in the original program. Are they still involved?
Right, that was Altice provided the actual in-home internet services. So it was all facilitated in partnership with Ralph Valenzizi's office. So Altice, through the Dalio Foundation, paid for up to 1,000 families who needed in-home internet services that the Family Navigators helped facilitate it with Ralph Valenzizi's office on the district side.
Thanks.
Thank you.
I'm sorry, I did the raised hand part. So is that, can I answer? Um, how do I explain this question? I first want to say thank you to James Martinez for pulling out and saying what's happening in our backyard, right? Like we can talk about no minimization, but Texas isn't that, but we've had stuff happen right here, right in Norwalk that we need to look at, like Norwalk, right? But secondly, what my question is on a brushstroke for everyone is just wondering, how do you feel about the dealings with cultural sensitivities, especially those who have more of a conservative look to the majority of what you're saying in that cultural sensitivity and working with that? Like, for example, just using it because I am it, but there's several Caribbean, Haitian Americans or Haitians or whatever that are very more reserved, very more, much more conservative, and probably would hold those, they'll need the help, but they're a little more prideful, or there's certain things you're discussing that they will not discuss or don't want to be engaged in and don't want their children to be engaged in, nor do they want them speaking to their children about it. How do all of your resources help equate to those sensitivities? Just wondering.
Sure, thank you for that question, Councilwoman. Jim, you want to talk about it from the school side, then we'll pick it up on the city side?
Absolutely. So a great question, and it's a dynamic that it's inherent in the work that we do in the school system. I mean, it's been something that, for example, all the support staff and mental health people that we have and professionals that we have in the district, one of the things that they always have to, take into consideration are the, the cultural aspects and differences and so forth. Ironically, though, one would think that this collaboration of this partnership that we've been able to now establish, and that we're going to, enhance even further. And I'm going to tell you, give you a quick example. When we talked about the family navigators going to families during COVID, and the focus was predominantly, internet access at that time. Here's what happened. Some of these families, when the family navigators got to the homes to talk about internet, well, it turns out that those family navigators were able to, kind of walked into some situations where families were in need of food, were in need of, all kinds of different types of resources, and had different issues going on that they were able to identify and therefore respond to. So it wasn't just, it pivoted from just the internet piece to then, getting that wellness help. And then it became an articulation between the family navigators and the school district. So with the consent of the families, and so the families that Diana, that fell into that profile that you're highlighting, they developed this trust with the family navigators, so that the family navigators can then communicate to the school. Because if a child, let's say this, the family of the child that has the issue with, they're lacking in food, we see that when they come to school. We see the adverse impact of that when they're in the classroom and they come the first thing they walk into the classroom. So that's why this partnership is even more important now, because now it gives these families an opportunity to get the support they need, but without that sort of anxiety, if you will, of them feeling like the school is now going to be involved in my personal life or business or thing, or, you understand where I'm coming from, because a lot of families become private that way. And so it really worked out well and by default, but it's something that now by design, we're going to continue to enhance.
I thank you for that answer. And I pretty much am sure that trust and relationships are a big part of it.
Major.
I just want to express it, because a lot of the times, coming from it, being a child of it, raising a child in it, just understanding where those values can be and why it can be limiting, or even feel like a put off, because I don't want to deal with this. I don't want to discuss this. This is my issue. You know what I mean? So I just wanted to kind of voice
100%.
that.
I can relate to you quite a bit, by the way.
Yeah. Yeah. I know. Thank you
can't
so
wait.
much.
No problem.
And I appreciate all your work, everyone.
And just to add, because one thing, I haven't shared a lot is that, one of the pillars of the launching of the Family Navigation Program is that we were very, what's the word I'm looking for? We were very intentional around identifying individuals that may have their own personal lived experience. We weren't looking for, some of our family guys do not have, a four-year education, but they had the experience. They understood families. They themselves may have their own personal experiences. And Councilwoman, you know that we take pride in having English, Spanish, and Haitian Creole. I think that's a component that really makes the difference. And I think the other piece that Anna Vivian is going to be building, enhancing, that we don't see ourselves as a traditional agency in the sense that you have 20 papers to fill out to do intake. That's a put off for families too. Culturally, I want all your information. Hold up, wait a minute. And so, we do look at not just the trust and relationships, what I think is important, but it's how we show up. And what we also have found is that when one family have been treated with dignity, with respect, they will tell family members and other people in their neighborhood. And we've seen that. I personally observed that time and time again when we ask, how'd you know about us? My neighbor told me. Go to those people, they help. And so we pride on that, and we want to continue to build that model and that approach. So when families do reach out, or we're reaching out to families, they know that it is a safe place, that you're being treated with dignity, and we are building that trust and relationship.
Thank you.
Thank you.
Kara.
Yes, hi, good evening, everybody. And thank you to Councilwoman McMurr and Johnson for including me in tonight's panel. And thank you to all of you for all of your hard work and efforts on this critical topic. Everything that we're talking about here is incredible. And the services that are being provided, amazing. But obviously very concerning are the numbers that Ms. Watts presented. As we know, so many in this country and right here in our community are in mental health crises right now, in the wake of the pandemic. And I guess, and I'm not sure who to pose the question to, but what I'm, concerned about right now is, we've only got a few weeks left of the school year, and all of our students are going to be, leaving our campuses and leaving the structures of our schools and their school days, and with that also parent communications that come from schools that often include exactly these types of resources. And so, and again, I'm not sure who can answer this, but what are thoughts or plans around communications over the summer to make sure that our families know what's available? If they're not already familiar, with what can be provided, if, a student was to go into crisis over the summer and a parent didn't know where to turn, like, where is this information readily available? And are we actively promoting it and, making sure that it's out there?
That's a great question. We actually have that as part of the presentation. And Chair McMurr, I was wondering, because we still have a couple of more presentations,
okay,
and then I promise
Sorry,
we'll get back
ahead.
to you. No, but that's
Okay.
a great question, but we are most certainly prepared to share. And you're going to hear some great, exciting things.
Okay.
So Danique, I'm going to say, would you tee up, but I'll just share this, that, COVID forced us to create a new blueprint of how we as organizations interact. But most importantly, how do we get information out to families?
Right.
And once Danique finishes her piece and Margaret takes it up, we're going to share how we did have to create this new blueprint to get information out, but also being sensitive, which we've learned through the Family Navigation Program and through the district. Not everyone has access to internet and readily available.
Right.
So we'll speak to many of those lessons learned that it's a work in progress, but we definitely have seen progress. So if you let me let's get to the agenda. We got 2 more things, and then we'll circle back and tee it up to where people can find it. What are we doing and how are we making things happen so families are aware if they need help, where they can turn to. Is that okay?
That sounds great. Thank you, Lamont.
Great. All right, so Danique is going to quickly just share. We talked about the school, we talked about the city, but there's these larger initiatives happening. Almost to your point, we want to get everyone to start talking about why social emotional health is important. And so Norwalk Acts, who is the collective impact backbone agency, really is that coordinated entity working with all the nonprofits, maybe up to 100, so that we're all talking about the same thing. So wherever our sphere of influence, meaning people we serve, whether it's the school, the many nonprofits, there's an understanding and common language. So we are promoting social emotional health. Danique, good evening. You take it away for us, and then we'll tee up Margaret right after.
You got it. All right. So Margaret had alluded to it, especially when talking a little bit about the data. But last fall or August, we developed a logic model based on the data that existed from last year's youth survey that really helps to not only inform our process, but also really help to lead it. We are a data-driven entity, so we love data and really want to use that to really be able to form the action plan. Within the Norwalk Acts initiative, social emotional health, or what was formerly social emotional learning, has always been kind of like a core facet, with really this North Star goal of having every Norwalk young person being connected to a supportive adult in the community. We are also in the process right now of really deep diving into what that can really look like. So there will be more to come, but what we know just based on the initial planning meetings that we've had with many of the partners who you've already heard from tonight is really around how are we using this developmental relationships framework with this data to be able to really build trust, relationships, supports, and really do that upstream preventative work to ensure that not only are our young people better connected, but they also feel affirmed, that they're welcomed, that they know that there are people both within the school district as well as out in the community that they can talk to. And on the converse, also ensuring that our adults are ready to receive these young people. So a core facet of the work moving forward is also going to be about how are we really building capacity within our adult population to really meet those needs. So there will be information and education. So for example, a lot of you were at this previous Saturday's Norwalk for Mental Health. Like, yes, it was a wonderful event. And we look forward to being able to offer those kind of opportunities as well as trainings for the general population to really kind of speak to what Lamont had really keyed up at the very beginning of reducing mental health stigma. But another core piece to the work that we're going to be doing with supporting young people is really ensuring that everyone has a good understanding of mental health and the resources and supports that are available. Not only within our behavioral health system, but I think that as evidenced by some of the pieces that Anna Vivian had already raised, other dimensions of wellness. So really making sure that that is a core facet, as well as I think to Councilperson Ravulis, really ensuring that there is that strong cultural competency piece so that we have communities or trusted organizations within our communities that are trained and ready. And we've already started to do that work. So as part of just the offerings for Mental Health Month alone, we partnered with Triangle Community Center to offer LGBT+ 101 to exactly mirror what was already happening within the school district. We've done that with trauma-informed care. We offer restorative practice trainings and boosters as part of the initiative additionally, and we look forward to doing that in a more intentional way. So really looking at the strategy of, within our work with talking between systems, we have a strong out of school time provider network. So, really, this is an opportunity for us to be able to not only speak to community at large, but really to be able to use those providers in a way to really help to inform what this work really looks like and how we can further support Norwalk young people. So our strategy that we're working towards is kind of 4 core pieces. So it's around information education, skills training, youth supports. So recognizing that we would love to have, every Norwalk young person be matched with someone, but also like there are other kind of creative ways that we can also kind of increase connection. So whether that's forming new youth groups or, peer-to-peer supports or what have you. So really looking at those other alternatives as well to help support the work that's happening on the behavioral health side, as well as the environmental strategies, like recognizing the importance of signage, making sure that young people know when they walk through the door that they are welcomed and affirmed, enhancing access. That's already really been spoken to with this kind of referral process, as well as really just continuing one of our core cornerstones around advocacy and policy. So really doing that both on the local as well as the statewide level. So like I had mentioned, it's a work in progress, but we know that we have wonderful providers within our community. We talk amongst ourselves all of the time, and it's really an opportunity for us to enhance the work that we're already doing together. So really looking to be able to not only have you all as part of kind of upcoming events and what have you in the future, but also to kind of keep you up to date on really what does that really look like from a prevention perspective in tandem with the other work that's happening between the city and the school district.
That's awesome. Thank you, Danique. So you can, I hope our council members and those listening to hear that. And when I talk about the city, I'm not necessarily talking about the municipality, but the city as a whole, which consists of our schools, our city services, and our community partners, and having Norwalk Acts be that thought leader to keep this and help us synergize all the things that are happening, only just increases the ability to serve, but also identify those gaps and identify those that fall through the cracks, because we know that's real. So we're always talking about that. I just want to mention too, that as we get transitioned to Margaret, that the superintendent is aware of this meeting, obviously, but just wanted to acknowledge that Dr. Estrella, my office is in constant communication. And in fact, she just appointed Mr. Rob Pennington, Assistant Superintendent of Schools, as my direct contact. And so we now have the bat phone with each other to make sure we're in communication. And we're looking forward to host, I think maybe the first of its kind, at least in the city of Norwalk, under her leadership and mine. The executive directors of all mental health providers will do a meeting with her and her cabinet, so that we as a provider community can wrap our arms around the school district and use what you are hearing to build that system, because that's what we're talking about. To Jim's point, it is happening, but we know we want to build a formal system to formalize it so that it's sustainable, so that unfortunately, to the point that we talked about at the beginning, things are happening, and we cannot be silly, for a better lack of word, that it can't happen in our backyard, and we want to serve our children. We want to provide, because they're hurting and grieving on so many levels as well. So we're just excited of the partnership we're having directly with the superintendent's office, and of course through Jim. But just want our viewers to know that oftentimes you'll hear the providers talking about it, but these conversations are also happening at the top, which is important. So thank you to Superintendent Estrella and Jim always for your work and commitment. We always have you at a lot of meetings, Jim, because he's one person and he does it. He does it.
Madam, Madam
So
Chair,
thank
It's
you,
my
Jim.
pleasure.
Yes, Person Revolus.
can I just go back and ask Danique another question? Well, maybe not even a question. I just wanted you to be able to speak. First of all, the mental health, Margaret and Danique, was amazing. It was a great day. I had a lot of fun. But I also want you to be able to speak to your outside of the box thinking about certain things as well. You know, like you, and particularly, I want to say thank you for giving me the lane of, you know, nutrition, you know, we had a great thing, and then the arts and how impactful that helps as well. And I just wanted to see if you could speak just a little bit, because it was part of something that you both give a lane to, and it's very receptive, you know, and it's just another not so I forgot, not so formal way of dealing with a very formal topic.
All right, Margaret, we
Danique or
tag team in
Margaret?
this one? Okay,
Yeah,
well,
yeah, go for it. I'm gonna pull up a picture.
okay, all right. So I know that well, I'll start at the beginning, and just to say that the Norwalk for mental health event was something that Margaret and I talked about very quickly and got off of the ground. And as we continued to kind of work through what this could really look like for the community, we were also thinking about, like, how do we really incorporate these 8 dimensions of wellness? The 8 dimensions come from SAMHSA, from the federal government, and really kind of speak to all of the different components of wellness. And I think that it's reflected within the youth survey data that it's not necessarily just you know, across race and ethnicity, but we know that those young people who may not necessarily be securely housed or may be in families with financial strain are also feeling it. So really being able to incorporate those 8 dimensions to be able to talk about, you know, bringing in a community bank to talk about finances and how to make a budget, to be able to talk about the importance of art expression and to be able to have those creative outlets, nutrition and health, and like the foods that you eat really, you know, can motivate and dictate your mood and those connections. So I think that as we continue to kind of build out what the plan really looks like, we'll be really reliant on really being able to incorporate not only just the formal evidence-based trainings, but really to be able to leverage the really wonderful resources that we have here. And I think that it was reflected within the tabling that we had as part of the wellness event. It wasn't just about our behavioral health providers, but it was about connections with social services. You know, if you're a young family, making sure that you're connected to early child care and early childhood. We had a dentist, you know, Griffin Hospital did vaccines. So really trying to kind of incorporate that as part of just the way that we really think about wellness is obviously, I think, to Margaret and I's, you know, heart. So more to come.
All right. Danique said that perfectly. So I know we're sort of at the end of the presentation. I'm going to reshare my screen because we wanted to talk about where people get help, but also, oops, now I've got to find my slideshow again. Just one more quick slide, because we've been talking about kids, but also briefly just something about adults, and then where everybody can go to get help. So last year, in addition to the youth survey, through our grant, we conducted a community survey of adults. We had a smaller response group, but I just wanted to show, this was last March 2021, and we asked adults in Norwalk in what way COVID had affected them in terms of health, finances, you know, employment, like a whole range of things. And their emotional well-being came out as the #1 biggest impact. 29% of people reported moderate or severe anxiety and depression. We actually built an official, like an actual clinical screening tool right into the survey. So these are, clinical measures of anxiety and depression. For comparison purposes, those numbers would have been about 17% prior to COVID versus like 30%. And you can see again an impact on people's relationships, and they also reported poor access to mental health services. We did actually put out on social media another version of this survey just last month prior to the walk. We got a very tiny response rate. It was just kind of to see if we could see how things might have changed. So it wouldn't be statistically significant, but what I did notice in those results was that this number of 29% increased to 35%. And people were able to say, on the clinical tool, they could get scored as having no symptoms, mild, moderate, or extreme. And those reporting extreme symptoms doubled from 7% to 14%. That's anecdotal, but just I wanted to point out that, things haven't necessarily gotten better, right? Trauma sometimes takes a while to make its impact felt. So now the question is, where can people go for help in Norwalk? I'm going to show this document on the screen and show you where you can find it on websites around the city. This is a document we made last year for the press conference for May is Mental Health Month. We've updated it multiple times. It's always updated on the norwalkpartnership.org website. And so what this list that you can see here is, first of all, the hotlines that we really want everyone to know. And all of you right now who are listening, I hope you have at least the crisis text line in your phone and go home tonight and get all your family members to put it in their phone. And also probably the National Suicide Prevention Lifeline, which as of July will just be the 3-digit number 988. But 24/7 free multilingual lines that we want everyone to know about. And then the nice, easy answer for youth and adults in Norwalk who are seeking services and don't really know where to start is that they can call the city. So the community services, the family navigators, here's their phone number, and the Youth Services Bureau. They're not going to get direct services there, but as Anna Vivian explained, they can be walked through, connected. There's a sort of an assessment of, you said you're calling about mental health, but it sounds like you might also need X, Y, and Z social services. So there's a great connection. We've talked at length, Diamond and Jim, about all the in-school supports that are free and available. So those are here with, a slight sort of differentiation of what they provide, like the school-based services from Mid-Fairfield are mental health counseling, whereas Diamond's Health Center provides behavioral health, but also medical and physical, and what are the room numbers and so forth. We want people to know that there are all kinds of free peer supports that are available. These are the ones specifically where you can find resources in Norwalk, but they're everywhere. When I say peer support, I think people tend to think of 12-step programs like AA, but there are a whole host of options for different purposes, for parents, for substance use, for mental health, that people can take advantage of. And then on this page, so this prints out, double-sided, here are the nonprofits that we have right here in Norwalk. And as you can see, for each one, you can see who it serves and what they provide. So Catholic Charities does mental health counseling for all ages, English and Spanish, whereas the ACRA program does substance use treatment for teens from 12 to 24, also English and Spanish. So this list is, if people want to go through the city, they can have a whole assessment and a process of helping them figure out who to call. People may want to just go through this list and call directly. Here are their options. And the last one here is that if people are looking for something more specialized than the nonprofit community in Norwalk provides, or they don't want to be served in their community, or they're calling around and there's wait lists, they can go to the HUB, which is the Regional Behavioral Health Action Organization, and look at their treatment list. I will say this guide, I think, is just very helpful to anyone in Norwalk, because why wouldn't you start with the agencies in the city? But of course, if someone wants to go to a private provider, you can go on Psychology Today and look for someone and see if they take your insurance. You can look at your insurance company's web listing of providers, which may not be always up to date, but there are multiple ways to get help. So I'm I want to show that we have the same document in Spanish. Where can people find it? Multiple places. So the Norwalk Partnership, we create this list and we keep it updated. There are a lot of resources on the norwalkpartnership.org, but that list in particular, you can find by going to our resources page, to the Get Help page. So I'm just going to scroll down. You can download it here. There's a slideshow about emotional supports for teens. You can access all these documents right here, click on them and download them. Or if people are on their phone and they really can't download something, here's a slightly larger description of each of those programs for behavioral health. And you can keep going, and past the behavioral health are the resources that are other types of support services like case management, connection to resources, child abuse programs, HIV/AIDS, needle exchange and all of that, and a video down here for teens. So all these resources are here on the Norwalk Partnership website. If you want to know where to find them on the Norwalk Public Schools webpage, I did have to kind of dig around to look for it, but it's under, for families, additional resources. And if you scroll down far enough, you can find a link. You would have to know to go to the Norwalk Partnership page. I have talked to Ralph Valancisi in the past about trying to have this on all the different school websites. Some school websites have it more prominently displayed. And the community services page, Lamond and Ana Vivian's page, has it listed here as well. So people can find it both here, and also the Norwalk Acts out of school time providers list is here in addition. Coming back here, I just wanted to say again that the hub is the regional nonprofit that does not provide direct services, but does provide sort of coordination at the regional level, meaning Southwest Connecticut. So you can go to their website and download a more expanded list of services from Greenwich to Westport. And I'll show you what that looks like. There's another one for the greater Bridgeport area. It looks like this. It's a whole, actually, can you guys see me? It's a whole booklet, and it's got all kinds of resources. And what I'll point out is that, we can provide these to anyone on request. There are services for adults, services for youth, and then a page that is specialized services, because, for example, if you're looking for eating disorders treatment, most of the nonprofits don't have that expertise, right? You might get started in your nonprofit counseling center, but there are places like the Anxiety Institute down in Greenwich, high focus centers here in Norwalk, which provides IOP and intensive outpatient and partial hospitalization programs for teens and adults. Renfrew and Wilkins that provide substance use services. These ones are for-profit agencies, but they are specialized niche care. So all of those are also in here, and everything is hyperlinked everywhere. So you can find the information. We want people watching this recording to know that they can access this information.
Awesome. Thank you so much, Margaret. So in addition to the online resources, just want to, Teresa, I think I might bring you into this conversation just so we can hear your voice. Our community health director, Teresa, can you just speak to how we have used the school nutrition sites to disseminate information, because we want to do that again. And I also want you just to speak. Teresa is here because she just wanted to listen in, but I think I told her I was going to call. I said, well, I might call on you anyway, but she's been amazing from the community health side, representing our health director and health department, has been also instrumental in promoting many of the services. And Teresa, would you mind just share about the community health workers as well?
Sure. Yeah. So to the questions about how we get information out to folks, it's all hands on deck, right? So the health department is working closely with all of the other folks on this panel and lots of other people in the community to figure out what resources are available. And then we have several staff members, and many of our partners have staff members who are out there in the community. They are setting up tables outside of person to person, outside of the grocery store, outside the train station. handing out information, flyers with QR codes and cards for people to take home with them. And so sometimes the messages are specialized to one topic area. Sometimes they're everything soup to nuts, community wide. And so one of the big things that we work hard to do is to make sure that those community health workers, both at the health department, our partner agency, Family and Children's Agency, and lots of other partners are well aware of all of these services that are available and where to point people. And sometimes that's, their business card to say, call me when you get back and I'll look it up for you. I'll help connect you. I'll find you the right name and number to get you the information and the services that you need. So we've been so grateful to be able to bring those folks on board. To Lamond's point, they are folks that live in Norwalk and know our community and have a lived experience to be able to discuss these things with folks and give them information in a way that is understandable, digestible, and trustworthy, right? Because I think people are talking about developing relationships and being trusted messengers. And on this topic, that's very important so that folks feel comfortable in asking follow-up questions and actually accessing those services. So the community health workers are out there giving out information and pointing people in the right direction. And then we work so closely with a lot of the agencies that Margaret was listing on those resource guides, is trying to convene those partners, make sure everybody's aware of everything that's going on, aligning the message, and then making sure that even if we don't have the right answer for someone out in the community, that we know who to call, who has that right answer, who has that information, so that we can get that to them. And so as we work with the hospital and many partners on our community health assessment, which we do every 3 or 4 years or so with the hospital, this will be a big part of that, is collecting information about what the needs are in the community, and then most importantly, what are the assets and the resources that are already out there and available, so that we can make sure that they're utilized fully.
Thank you so much, Teresa. So we also partner with our larger, I'll call them institutions, for example, like Norwalk Housing, to disseminate information to residents. Our public library is an amazing resource under the direction of Cheryl Harris, making sure we're promoting those services in our library. Our residents utilize both libraries, so we know that residents frequent those places, so we're promoting mental health in those areas. We're also obviously using all of the city's social platforms, and then working with Brenda on the district side that oftentimes don't amplify specific information outside of their usual process, and periodically they will promote and have partnered with the city to promote these critical resources to families. And then Kevin, who's just an amazing guy. To your point, Kara, as we move to the summer, many of our schools will become food nutrition sites where families can come. And we just learned this one day this week. I don't remember what day.
It's Wednesday.
When is it, Teresa?
On Wednesday, yeah.
On Wednesday, that many schools and in community sites, again, using data to meet the need, that families for the entire summer can get food. Well, we want to make sure this information, and that's the paper component to my point earlier, that everyone may not have the capabilities of internet. So we provide even literature at these sites so family can go home with it. Mary Astor, our early childhood centers, we're always giving information to our early childhood centers to make sure. So we work diligently to promote both through this platforms that was discussed, but also looking at those larger organizations that have direct contact with residents. And then always reminding ourselves that the translations, that we're very sensitive to that. So we frequently, our literature is always disseminated in English, Spanish, and also Haitian Creole. And we continue to think creative and be creative to make sure that our residents know that no matter what their situation is, we want to remind everyone that help is out there. There are a variety of services and programs that exist in Norwalk. Give us a call, go online. There are many ways. Our commitment is that when you call us, we'll give you our very best to help you get connected to the very best. I want to just personally thank the panel, thank all those that participated. Thank you for your time, your expertise, your commitment. I really, really thank you so much for being here tonight and what is such an important discussion. At this time, Chair, I'll yield the time back over to you.
Thank you so much. Just a admin thing. I want to note that Councilmember Tom Keegan joined at 8:32. I didn't want to interrupt anybody. Councilmember Revolus, you have your hand up.
Okay, I'm gonna shut up soon. I'm so sorry. I just have one more question. And Diamond, I might need you, so come back up. What is your follow-ups with families, in particularly students who graduated in 2020 and 2021 in particularly? So like, let's say I went through everything or whatever, but now I'm in a school, college, and I'm back. Do I follow up with you? Because I've been in your health centers before, and I may be still having problems, but you know, at my school or maybe our families, yeah, I use some supports, and because I use the support, we're doing very well. Like, what are our follow-ups, in particularly, Diamond, where I called you, with our students, and in particularly for students who were in classes 2020 and 2021?
So unfortunately, with the school-based health center, those kids, once they graduate,
they're gone, right?
Yeah, if they're still on our services, whether medically or mental health, the whole point of the school-based health center too is to enhance these students to also be able to speak on behalf of their medical and mental health personal health. So when we are seeing them, we refer them out. So we never just leave them. We refer them out to either a community service or connect them. If they go to NCC, we connect them because we do have that relationship with Wendy and Kathy over there in the mental health services. So we refer them either to NCC or Family and Children's, or some of our providers does have the privilege of having private, oh my gosh, I'm going health. They're private mental health providers in our community. Yes. So they take them onto so they still have that rapport and relationship. So they see them outside and then they become their private client because they do take Husky or non-insured, whatever. They figure that out. But if they don't, then they refer them to another community provider. Mental health wise, we really try to get these kids connected to a primary care, because once again, school-based health is not a primary care provider. So we try our hardest to get them. Some of course don't, but some we do the best ability to get them connected to either Noah Community Health on Connecticut Ave or Day Street or Planned Parenthood, whatever, you know, their need is. So does it always happen if they don't follow up kind of but we do make that referral and try the best. We've even sat and called and made appointments with them. And we're actually going through that process right now with the end of the year of our seniors that we see now. So it's nice though, for the seniors that we do have now, because we're going in the summer, we will see them up into the summer, and then August or so, that's when we will start that referral process for mental health. But all medical wise right now, if they are seniors, they are being referred out to the community.
Okay, all right. And anybody else with like adults, just to, you know, just a follow-up, like because there's data to how well they've accelerated, right? Or if they're still at a baseline. So I was just wondering, like, what are our processes with the follow-up? And thank you, Diamond, for that. But you know, adults too, I guess. And if that's not been questioned yet, that's okay. Maybe it's just an idea to throw out there on what does that look like.
So Diane, Lamont, do you
Go
want
ahead, Anna Vivian.
You know, I can't speak on all of the providers, and unfortunately, you know, we had a full panel, but we don't have representation from every single agency that we collaborate with. So each agency does have a follow-up model. It depends. Some of them do 3 months, 6 months, up to a year. It's usually referred to as retention services. And so they'll continue to follow them. But it really depends on the agency, and it depends on what service that was being provided. You know, for family navigation, for the services we provide at the city, our follow-up is it's a little more fluid because all of the services are kind of open door and you can always come in. And also because it's 100% determined by the family and how they want to engage. So it gets tricky. It isn't like a standardized piece. Of course, we always want to make sure they made it to the resources and that they made it through the door, but it isn't like a fixed model the way you would find with some of our other service providers where they do the retention services to make sure that they can do those check-ins at periodic times.
Okay, thank you.
Welcome.
Kara, did you have a question?
Yeah, I did. And I'm sorry, I don't mean to like harp on the getting the word out thing, but I'm just so impressed with like all of these resources. And if I'm being honest, I did not know that the Norwalk Partnership existed. And I've lived here in Norwalk for almost 20 years. And so I'm just curious to know, and this is probably my advertising background coming out here, to know, what other avenues or mediums have or been used or are being used other than the internet, because as we've always said, like, we know not everybody has access, they're not savvy, that's not where they go for their information. I was happy to hear that, print, documents around what the offerings are being disseminated within, different communities and also at the meal drop-off locations. I think those are great, but has there been any, and I don't know if there's any budget for this, but any investment or any kind of like media planning around alternative methods of communication, such as radio, television, bus benches, other kind of vehicles for getting this information out? Because if it's not out there, if people don't know it's there, then, it loses its value. So I don't know if Lamond, you can speak to that, or who could speak to that, but I just feel like there's, I don't know, the way that it's getting out is not like as strong as it could be. And so I just wonder what.
Can I just say that Norwalk Partnership has been doing amazing, because I know I talk about digital signage, and they had amazing job in doing work in digital signage and making themselves known, like in the DMV and stuff that Margaret just let us know yesterday. And I'm also a big component about like putting digital signage. I just want to give them a shout out for really like using it in the mall, so on and so forth. So as you guys go, I just wanted to give her a shout out on that.
Yeah, no, thank you for that. I was going to just point out that many of our nonprofits, Kara, as an individual nonprofit, we have seen some of them use bus signage and, benches and so forth. But as a larger collective, I think you raised the point about budget. And I think from a nonprofit perspective, that marketing budget is probably not always as big as we would like it. Speaking from my nonprofit hat when I was a nonprofit manager, but on the city side, our goal is to find every opportunity using our city's assets to promote these wonderful organizations using the city's, platforms to promote it. But that's always an area we've talked about this as I came to the city of Norwalk around how do you get the word out? And I think word of mouth, because I think the organizations will tell you we're definitely at capacity. But my point in that is always want to make sure, what about those that aren't aware? So I think there's always opportunities, and we'll be open to hear more from those that have expertise in this area to maximize what we may not know to take advantage of. So we'll love to have that conversation.
I just want to say, I know there's a couple of hands up and I want to get to them quickly. I just want to say that I'm a communications professional, and so I would love to help with that any way I can. But also I think that the literature that you've all put together and the website on Norwalk Partnership is phenomenal. I mean, I build websites for a job, and I just think that you've done such an amazing job. So the hard work is done. I think we just have to push it out more. And, you can push things out as much as you want, but it's never enough. That's what I've learned in my role. Councilmember Smith.
Yes, thank you, Chair McMurr. Yeah, I'd like to, go back to to the schools and our kids' mental health. And, you know, we were spending a lot of time talking about how they've suffered and the increase in depression since COVID, which is, you know, it's really important that we talk about that and we help our kids. But our kids were suffering before that profoundly. And I think it's really important that we look at the whole picture. And this is very timely because, you know, I've been thinking a lot about this over the last 24 hours because I was talking to a mom, another community leader last night after the vigil, who was crying and talking about her little girl's experience, who was in one of the lock-ins yesterday or a couple days ago, and then the next day was the shooting in Texas. And we have a whole generation of kids who live in constant fear, and they the school shootings, the lockdowns, you know, and I just, because I'm thinking about it, like I've been a little bit emotional about this myself over the last 24 hours, because I'm remembering back, you know, I taught in our schools for 12 years, and I was teaching at PONUS the day of Sandy Hook, and remembering what that was like for our kids and for me as a teacher, and then the subsequent lockdowns that we had, drills that we had to go through after that and continue to go through, and how genuinely traumatizing the lockdowns are, the drills are. And, you know, I remember for myself, sorry if I'm getting a little emotional, because it's like, I remember I would gather the kids and we would all be terrified. This is 8th graders, you know, back after Sandy Hook. And we would all be terrified, and I would just be, you know, like be my teacher self and take care of them. And then as soon as it was over, I would just shake and start to cry. And I did that for years. And so does most teachers do. And this is what our kids are going through, right? So we've seen such an increase in anxiety among our kids. And so my ultimate question here, you know, is directed to Jim and the school district. And I don't think that there is an answer or a right answer, but I've been thinking about the lockdown drills and how, you know, how effective are they? Are we just, you know, constantly re-traumatizing our kids by having the lockdown drills? And is there a different approach or a different way? I don't, you know, 2 years ago, 5 years ago, I would have never asked this question. I would have been, of course we have to have them. We have to be prepared. You know, we as teachers need to know what we have to do. But when you're in that situation, I don't know. I'm just wondering if there's another conversation going, if this is something that's being talked about on other levels.
So let me just tell you this, that
Totally
it's being talked about. It is being talked about. I will say that yesterday, for those of us, particularly who work in schools with children during Sandy Hook, it triggered a lot of those, you know, those feelings again. But I want to say that we often in education and even as grown-ups in general, I mean, we always focus on how making sure the kids are feeling a certain kind of way, but we overlook how the adults are feeling. And right now, I will tell you that I think it's almost it's equally important to respond to the social emotional state of the teachers and the staff in the buildings, and even all of us on this call, just as it is important to because what happens is that, and to answer your question, it's a larger conversation, obviously, but we're going to continue talking about it. But what happens is that one of the things that we can do, instead of having all these lockdown drills, which unfortunately we have to have them because of the nature of the events that have happened, but an alternative into lowering the anxiety of the students is to talk about, and this is based on the American Psychiatric Association. They emphasize how important it is that one of the priorities is to make sure that you communicate to kids and ensure their safety. Let them know that they're safe. The conflict is, and I've heard this from staff, is that they do that. They tell the children that, but they're saying that knowing that they can't really guarantee their safety, or they don't feel the safe themselves. And so that's why a lot of work needs to get done with the grownups. And so I have access to a lot of evidence-based resources for next year, especially to try to get support for our educators, for our teachers, for our staff, because at the end of the day, the students do feed, just like our kids, our children feed off of us as parents. They read, they see right through us. They read our emotions, and they're like sponges, like as you know. And the same thing happens with teachers. When teachers are anxious and nervous or scared, and they think they're hiding it really well, the children will see right through it. So we did a mindfulness and meditation initiative this year where we offered it to teachers. We did it last year as well. And again, we need to be more purposeful about how we protect the social emotional of the adults and the children. This has been the last couple of years in education has been one of the most, I've got no words. I don't even know how teachers, staff are like, how they're still standing.
I know.
And you know how
I'm
they're
no
doing
longer
it?
teaching, but I talk to teachers every day.
Every day. So
I don't know
they
either.
do it because they love what they do. They're committed. They love what they do, but caretakers need to be taken care of too.
And I think, talking to that mom last night, even though I know that my youngest, who's about to be 21, was going through those lockdowns when he was in elementary school. As a teacher, I always taught middle school or high school. So I've just found myself really thinking these last 24 hours about what these little kids, the kindergartners, the first, second, third graders, I mean, it's become a part of their DNA. And it's why we have such an increase in anxiety. There's a lot of reasons for anxiety, but it's got to be a major contributing factor to the high increase in anxiety among this generation. It's
without a doubt, and I appreciate you bringing you highlighting that that issue, because it's something that we need to really work on a lot more aggressively, and we need to really be more thoughtful about that.
I don't know how you do. I just think we just need to constantly be thinking about it and maybe find different ways to prepare that are less traumatizing to the kids.
Councilmember Alterman.
Thank you, Chair McMurray. I apologize for still being off camera. I am just not feeling well. I had 3 questions, so I'll try to keep it brief. First, I wanted to say my daughter goes to Cranberry School, and they started like a mindfulness program for the entire school, as well as what the teachers were doing. And it was so lovely. My daughter would come home and just talk about how it was her favorite part of the day. And I was really grateful that the school system, is doing that. I had mentioned sort of like as a joke once, perhaps at council meetings, we could do like 1 minute of mindful breathing, just as an example to other people in the city. I may start pushing for stuff like that again, because I think there are some people that don't know simple things like if you just try to control your breathing for 1 minute, it can relax the rest of your body. Anyway, so my question, one that has nothing to do with that, was, do the farmer markets in Norwalk and Westport still all take like SNAP dollars and the other types of government assistance money so that people can use it to get like fresh vegetables and plants and stuff?
That's a
Teresa, you want to take that one?
Yeah, it's a very timely question. We just released the list of the 4 farmers markets in Norwalk. I'll pull it up real quick and check, but it does list which payment options are taken at each market as reported by the market managers. And I do believe that
Yeah.
most of them do take SNAP, WIC, double value coupons,
Yep.
and those kinds of things. Yeah.
Yeah, I actually promoted the graphic and then I thought I cannot remember if it had anything about it on it. So I'm excited about that. The second question was, do the schools or like primary care providers from the city, like the health department, are they doing simple depression screenings on everybody? You know, there's like the Beck's depression inventory scale, stuff like that. Is there a way that that just starts happening in more regular settings?
Jim, you
I
want
mean,
to
I can
speak
answer
to
on
that?
this. I can answer from the district side. We have two tools and resources that we were just introduced to this year. And one of them is through the panorama survey that we administer every year to families.
Mhm.
Where we were able to, their dashboard was able to include an SEL check-in tool for classroom teachers to use with their students. And it communicates, and I don't know what the technological term is, but it communicates nicely with PowerSchool, which is what we use as our database system in Norwalk. And it's able to, so what it is just it's like a 2 to 5 minute screener that's done periodically, that can be done as needed to do check-ins with students as to where they are at. It will ask some questions, and it even populates some instant charts and data that will help us screen and identify students who are showing a pattern of sort of depressed behavior. And again, anything that's more than half the day, like Margaret was alluding to and that was mentioning in the survey, for a period of time, and it becomes disruptive to normal daily functioning, and that warrants a response, and that warrants someone getting support. And then we also were chosen by the state of Connecticut, the State Department of Education, to be part of a cohort where there's also a similar tool that's going to be used to be able to do that within the school system. So that's actually going to increase for next year.
Okay, great.
Thanks, Jim.
You're
And
welcome.
Teresa, for any of our clinical programs at the health department, what type of screenings or assessments we do?
I'll have to get back to you on the clinical side. I do believe the WIC program does do
That's what I was
a
thinking.
maternal depression screening during one of the initial sessions. But in terms of other, our immunization clinics and those sorts of things, we're not currently doing any of those screenings.
Okay, because I know sometimes I'm not sure what happens in Norwalk, but a lot of them had started doing substance use screening, like just at every single visit. And that was getting a lot of people a lot of help earlier, so they weren't like rock bottom before they were like, I have a problem. I'm glad to hear that they do it with WIC, but I'm wondering if there's a way to sort of push for that to happen more. I don't know.
I would imagine that the primary care providers in town are doing that sort of screening. And I know the substance use question has been incorporated. We're not a primary care provider. So that's not that.
Right.
But I definitely think that's something that we can bring back to the team in terms of other places that we can incorporate that kind of questioning.
Okay, great. Thank you. And I'll just ask my other question another time. I think it's too lengthy.
Are you sure you don't want to ask? You're more than welcome to.
Yeah, no, I'm sure. I actually just I have a really bad headache, so I think that's probably as much as I can talk, but thank you.
No worries at all. If you change your mind, let us know. Councilmember Johnson.
Thank you, Chair. I have so much gratitude in my heart for all the work you all are doing and this collaborative work, how this is just emblematic to me of the best of our city. And I just want to thank each and every one of you for everything you're doing and how you're working together. And I almost don't have words for it. On a personal note, during the pandemic, and this is even before, this goes back to my time as an educational researcher studying these issues. Our LGBTQ kids, they oftentimes don't have anyone in their family of origin. And that's why, and I'm not going to infer anything from the partnership data, but I knew from the pandemic that was often the case. They were put back into their homes with no one to talk to. And the people that were the people that made all the difference in their life were their teachers, and they did not have access to them. And so for me, it's very, very important to see everything you're doing here for all of our youth, but personally as an LGBTQ adult who is an ally to these youth, it means so much to me to know that you're looking out for them and that they have the full breadth of our city, our schools, and our community partners helping them along the way. And I love the fact I have so many friends who have LGBTQ kids, and they're so supportive and they're amazing people, and we're getting there. But I think that just in knowing that data is just, it's mind, it breaks my heart, and it makes my mind just think about all the ways these young people need help, and you're giving it to them. And I want to thank you for that. Thank you.
Thank you, council member. I just wanted to thank again you all, because we have, through your approval, have dedicated or allocated funding. Again, really looking at the data, and the data was very clear during our process that this population, the resources were not as par. So we're very pleased to be able to fund programming that will increase the capacity specifically for Norwalk Public School students, where the service provider will be able to provide those services in the school, meeting the youngsters where they are.
Absolutely. Thank you, Chief. And I'd be remiss to not thank those teachers. You know, I talked about them generally, but thank you, Norwalk Public School teachers, especially for our students. Thank you.
Wow. I just want to echo what everybody said and thank all of the panelists. If anybody else has any questions, now's the time to do that. I would like to be conscious of everybody's time, Mr. Martinez's bedtime and mine. I did say 9, it's 9:21 now. So does anybody else have any questions? I don't want to cut anybody off, of course. I just want to thank everyone. This has been really, really helpful and just so eye-opening. And again, thank you so much for all of the hard work you all do, all of the teachers, everybody on the district side, the city side. I think this is a really, really good collaboration and a really great example of how we can work together for our community as a whole. And that's what it's all about. So thank you so much for everything you do today and every day. And I hope everybody has a good night. So thank you.
Motion to
I have
adjourn.
a motion to adjourn?
Motion
Thank
to
you.
adjourn.
All those in
Thank you all.
favor, please say aye.
Aye.
That's
Thank you
unanimous.
all.
Thank you so much,
Thank you,
everyone.
everyone. Good night.
So much,
Thank you,
everyone.
everybody.
Thank you, Chair
Thanks,
McMurray.
Jen.
Thank you very
Thank
much.
you.
Thank you.
It was a
Bye-bye.
great